SBAA. SBU is the Spina Bifida Association's new viral education program. Our goal is to bring the world's best care providers and resources directly into your home. SBU is the only free webinar series dedicated solely to the educational, employment, social, self-advocacy, and health needs of people with spina bifida. We hope that you will enjoy this presentation, Sexual Function and Health in Men with Spina Bifida, and that you take time to complete the evaluation at the close of the presentation.
Good day. My name is John Weiner. I'm a urologist at Duke University Medical Center and work in the Duke Comprehensive Spina Bifida Clinic. I've been asked to speak on sexual function and health in men with spina bifida. Yes, it's true, my name is Dr. Weiner, and I'm going to be talking to you about men's health. So, why are we having this session, and why are you watching this? Well, sex is ubiquitous in our society. From this book in the 1970s, Everything You Always Wanted to Know About Sex, to women's magazines today. I found this copy of Glamour sitting in my house for my 15-year-old daughter, and if I look at the title at the top, it says, What to Do with the Naked Man. So, everybody thinks about sex, everybody likes to talk about sex, men with spina bifida are no different, and all men like to talk about their penises. Maybe even take pictures about their penises. Or things that look like penises. So let's talk about spina bifida for a minute. Look at the history of treatment of spina bifida. Until the 1950s or 60s, most infants with spina bifida died of hydrocephalus. If they did survive for the first few years, most died of kidney infections or kidney failure. But today's modern therapies have allowed the survival of nearly all patients with spina bifida. Looking at outcomes from the Spina Bifida Association website, 90% of babies born with spina bifida live into adulthood. 80% have normal intelligence, 75% participate in sports. Thus, there are adolescents and adults living with spina bifida. So, what do adolescents and adults do? They think about sex, they talk about sex, and they have sex. So, the initial questions that I wanted to know are, do people with spina bifida think about sex? Do people with spina bifida want to have sex? And do people with spina bifida have sex? Well, as an aside, let me talk about how we doctors go about learning things. We may make an observation or ask a question. We'll then conduct a study to answer that question, present the findings in a meeting, and then finally publish the findings in a medical journal. So today I'll be showing you some of these findings that have been published in medical journals about men's health in men with spina bifida. So, our first study here, Sexual and Reproductive Health in Young People with Spina Bifida. These are based on interviews of patients in Australia, and most were satisfied with their general sexual knowledge. 95% had inadequate knowledge about sex and reproductive health in people with spina bifida. 39% had discussed issues with doctors, which meant most did not discuss these issues with doctors, and 93% would talk about it if the doctor initiated the discussion. They also found that 60% of these patients with spina bifida had had an intimate relationship, and 25% had had sexual intercourse. In this study, of those having sexual intercourse, 15% of males had had sexual intercourse, and 37% of females had sexual intercourse. Unfortunately, 30% of the females had experienced unwanted touching. Looking at this study, a pilot study from the Netherlands of 11 patients, 10 of the 11 had desire for sexual contact, 5 had masturbated, 6 had had sexual contact, 8 felt that they had problems in the field of sexuality, and only 3 were dissatisfied with their present sexual life. This more recent study from Italy, looking at 172 men with spina bifida, asked questions about sex education, and 78% said they had good knowledge. But what were the sources of their information? For 50% it was friends, newspapers, and TV. 30% it was school. 23% was from their parents, and only 6% from their doctor. Looking at relationships, it was very dependent on the level of their spina bifida. If the spina bifida lesion was above L2 in the lumbar, above the lumbar region, only 43% had relationships and only 14% had sexual contacts. The same was similar for patients with lesions at L3 through L5, with only 36% having relationships and 14% having sexual contacts. Patients with lower lesions, sacral lesions, were more likely to have relationships, 48%, and 30% had sexual contacts. Looking at their study, and including 420 women with spina bifida as well, they looked at predictors of sexuality outcomes. Age increases the likelihood of sex by about 1.1-fold each year. That's not surprising. The older the patient, the more likely they are to have had sex. Secondly, those with urinary continence who did not leak urine, they were 3.5 times more likely to be in a relationship and 2.4 times more likely to have sexual contact. So urinary status is important. And then looking at the males, males were 1.7 times more likely to be in a relationship and 2.1 times more likely to have sexual contact. So in this study, men with spina bifida were more likely to be in a relationship and more likely to have sex. Now, looking at a study from Seattle of 52 men and 69 women, they found something different, that women were 1.7 times more likely to be sexually active. And they found a similar finding of that sexual activity increased by 1.2 times each year as the patient aged. They found that urinary incontinence decreased the likelihood of sexual contact by 0.77 times, or about a quarter. And women had greater sexual satisfaction. Excuse me, let me rephrase that. Women had greater satisfaction with their level of sexual activity than did men. Another recent study from Philadelphia looking at 42 men and 34 women. 24% were sexually active, and they found no difference between males and females. There were no differences noted between sexually active and not sexually active patients in the level of their lesion, the presence of a BP shunt, their physical health scores, or their mental health scores. So, let's go back to our initial questions. Do people with spina bifida think about sex? Do people with spina bifida want to have sex? And do people with spina bifida have sex? I think the unequivocal answer is yes. About 15 to 40% are having sex. So the next question, can people with spina bifida have an enjoyable sex life? Well, this study from Sweden, looking at 190 adults with spinal cord injury, that's SCI, or 41 with MMC, or myelomeningocele, which is also spina bifida. And they found that the median satisfaction with sex life on a scale of 0 to 10 in those with spinal cord injury was a 3 for men and a 4 for women. With MMC, or spina bifida, it was a 5 for men and an 8 for women. So the next question is, why do people with spina bifida have difficulty having or enjoying sex, and why is it more of a problem for men? Well, if we look at nerve dysfunction related to spina bifida, 93% of spina bifida involves the lumbar or sacral spinal cord. And many of the nerves controlling sexual sensation, erections, and ejaculation can be altered if there is involvement of the lumbar or sacral spinal cord. So, in this cartoon here of the male sexual organs, you can see that the nerves, the dorsal nerve of the penis that provides much of the stimulation, comes from nerves that come from the sacral area called the pudendal nerve, or the pelvic plexus. And so those nerves are important for erections and sensation in the penis. And these can be altered in spina bifida. So back to our study from Italy of 172 men with spina bifida, looking at sexual sensation. If their lesion was L2 or above, only 7% had normal sensation, 43% had decreased sensation, and 50% had no sensation. It was better if the lesion was L3 to L5. 53% had normal sensation, 22% had decreased sensation, and 25% had absent or no sensation. With the sacral lesion, things were better. 54% had normal sensation, 40% had decreased sensation, and 6% had absent or no sensation. So, looking at normal, the lower the lesion, the more normal the sensation. Looking at a study from Pennsylvania of 57 men with spina bifida. In this questionnaire from the 1990s, 72% of men with spina bifida reported having erections. 66% could ejaculate with their erections. 5% ejaculated without erections. 35%, approximately a third, had attempted sexual intercourse, and 21% had been married. A study from Japan showed that erections by audiovisual stimulation, basically watching pornography, 85% had erections of these young men with spina bifida. Erections caused by tactile sensation or touching, 58% had erections. 88% of the men reported ejaculation. 65%, or about two-thirds, had an orgasm at ejaculation. 42% had had sexual intercourse. And of these, 6 of the 11 were classified as having erectile dysfunction, but were still able to have intercourse. Sadly, none of these sought help or received therapy. So, if we look at this, looking at erectile dysfunction or inability to have erections, most are correlated with a level of neurologic defect. Here's a study from France of 40 men with spina bifida. 40% reported they'd had sex in the previous month. 25% said they had no erectile dysfunction. 19% had mild erectile dysfunction. 25% had moderate erectile dysfunction, and 31% had severe erectile dysfunction. What was the origin of the erectile dysfunction? It was mainly difficulty in maintaining an erection, not having an erection to start with. And they found that it correlated with sacral nerve dysfunction on an EMG, or a test of nerve function. So the more sacral nerve dysfunction there was, the more likely they were to have difficulty maintaining an erection. Again, from the study in France, looking at overall satisfaction and satisfaction with intercourse, it was not associated with the presence of a shunt, prior bladder surgery, urinary incontinence, or rectal problems. But their satisfaction was associated with not living with their parents. Here's another study looking at men with spina bifida. Erections occur in 75%. If the level is above T10, then less than 15% have erections. They found that erectile dysfunction occurs in 75 to 90% of young men with spina bifida. Only 25% of men in this study were satisfied with their erections. Many were only reflexive, meaning when it was touched they got an erection, but not with visual stimulation. 75% had difficulty maintaining erections, and 85% noted that the rigidity was not firm enough for good sexual relations. So in summary, only 15 to 28% of men with spina bifida have no erections. The erections are often unsatisfactory, and it does correlate with the level of neurologic defect. Why is it correlated with urinary incontinence? Well, if we look at this cartoon, we see that the bladder and urinary sphincter receive nerves from the lumbar and the sacral spinal cord. Of course, these are the areas that are affected in most patients with spina bifida. So the same nerves at the end of the spinal cord control bladder function as it control sensation and erections of the penis. So 90 to 95% of spina bifida patients have neurogenic bladder. If the bladder doesn't work, then it's likely that the erectile machinery in the penis may not work. And of course, if you have problems with urinary continence, it may cause psychological implications where one is more private and less likely to be intimate with someone else. So we need to understand how erections occur to understand how treatments for erectile dysfunction work. So I'm going to take you through this. The penis does not have a bone, as shown in this funny cartoon. So this is not what happens. It's not because there's a bone that's broken. Erections occur because of increased blood flow to the penis, and this cartoon shows several arteries that go to the penis, and with increased blood flow, the penis fills up with blood and becomes rigid. The blood fills the erectile bodies, which are these two cylinders, and as they fill up, just like hydraulic cylinders, they become rigid. And so these two large ovals in the upper part of the penis in this cross-section will fill up and become rigid. The small circle at the bottom is actually not part of erections. That is the urethra, where the urine comes out, or if you use a catheter, where you pass the catheter. So again, in this cartoon, in the flaccid or soft state, the areas that fill up with blood are small and contracted. In the erect state, the blood fills the sinuses of the penis in the erectile tissue and compresses the veins, shown in blue, and compressing the veins prevents the blood from leaving the penis. And it is inputs from nerves that is needed to start and maintain the erection to cause the increased blood flow. So erectile dysfunction in spina bifida, the cause is altered nervous input that controls blood flow in the penis, and that may be impaired. The symptoms are either no erections or fleeting erections, that erection is obtained but does not stay. So the next question is, can erectile dysfunction in men with spina bifida be treated? Well, there are a variety of treatments, so the answer, of course, is yes. I'll talk about these. The first is vacuum constriction devices. The next is vibratory stimulation, oral medication, intraurethral medication, injection of medication, and finally surgery, or penile prosthesis. So a vacuum constriction device is basically putting a vacuum device on the penis to draw blood into it. Shown in this cartoon, it does remind one of Austin Powers and his Swedish-made penis enlarger using suction, but actually this is exactly what is done. Here's another device that you squeeze and create a vacuum with a penis inside of it. Here's another device, and the white things at the bottom are rings that you slide onto the penis to hold the blood in while one is having sex, and then take off later for the blood to drain out. Vacuum constriction devices are relatively easy to use. They have high success rate in motivated patients and their partners, but there are some adverse effects from using it. It can cause ecchymosis, which is bruising. It can cause pain and numbness when that constriction device is on. It can block ejaculation because it's being squeezed, and the ring could stay on and cause problems if one falls asleep and forgets to take the ring off. And that's actually a very real problem in a patient with spina bifida that may have altered sensation. Vibratory stimulation is simple and painless. It's effective for semen retrieval. Basically, it's a vibrating device that's placed on the head of the penis, and the vibration stimulates the penis. Sometimes that will give an erection but will not maintain the erection, and again, it depends on the nerves working properly and may be dependent on the level of the neurologic lesion. It is used for semen retrieval because it can stimulate ejaculation even without an erection. Well, there's a lot of talk these days of the oral medications. They're called phosphodiesterase or PDE type 5 inhibitors. And the three brands that are on the market here in the United States are Viagra or sildenafil, and that was introduced in 1998, Levitra or vardenafil, and Cialis, which is a longer-acting medication. So Viagra is most known. It comes in 3 doses, 25, 50, and 100 milligrams. So this cartoon shows how these PDE5 inhibitors work. So if we start on the upper left, when the nerves are acting on the penis to cause an erection, they release nitric oxide. That nitric oxide causes an increase in cyclic or cGMP, and then that goes to the cGMP specific protein kinase, and that changes things in that cell and basically causes the smooth muscle to relax, and that causes increased blood flow when those muscles relax. And with the increased blood flow in the penis, one gets a firm erection. Down at the bottom, you can see that things like sildenafil, which is Viagra, act on PDE5 to prevent breaking down of cyclic GMP, and so that it stays around longer, keeps the muscle relaxed longer, keeps the blood flow occurring longer, and therefore has one get an erection and keep it longer. So blocking the breakdown of cyclic GMP gives better erections. So typically one would take these medications 30 minutes to 4 hours prior to the sexual event. All 3 medications are essentially equally effective. They work in about 50 to 85% of men with erectile dysfunction, and it depends on the dose taken as well as the cause of the erectile dysfunction. There are few side effects, particularly in healthy young men, and the cost is expensive. It's at least $5 to $20 per pill. So maybe like the cost of a glass of wine. However, these costs will probably come down in the next few years when Viagra is no longer on patent and will become a generic medication. So the next question is, do these medications, these PDE5 type 5 inhibitors, so PDE type 5 inhibitors, do they work in men with spina bifida? Well, looking at this study, 15 men with spina bifida aged 19 to 35 years, they took a placebo or sugar pill, Viagra at 25 or 50 milligrams. And their erectile scores increased 50% in those taking 25 milligrams and 88% in those taking 50 milligrams. The duration of their erection increased 192 and 266%. And their mean level of confidence in their erection increased 33% and 63%. Looking at this study from Italy, 10 men used the vacuum device or penile injection therapy, which I'll talk about, and 3 used Viagra, and they noted improved erections, and they all had intercourse. So let's next talk about intraurethral medication, which is Muse or Alprostadil, and this from the company's literature. There's a little pellet that you can see in the middle drawing, and it is actually placed inside the penis where it is absorbed. It also will stimulate increased blood flow and erection. So in patients with spina bifida, in patients with looking at all men with erectile dysfunction using Alprostadil, it works in about 7 to 25 minutes. It's effective in about 2/3 of men. It costs about $20 to $25 per use. And side effects can be pain or burning in the penis, some minor bleeding if you scrape things up, and possibly some dizziness. Next is injectable medication, here showing injecting it directly into the penis. Caverject or Prostadil, or some patients use a non-brand named mixture of 3 medications called Trimix. It's a self-injection. One takes a syringe and injects a small amount into the penis. It works in about 5 to 20 minutes and lasts approximately 1 hour. The cost is $8 to $30 per application, and the side effects can be pain from the injection, bleeding from the small needle, or if used in some patients, it can lead to fibrosis or hardness where the needles were stuck. And then finally, surgery or penile prosthesis, which is sort of the last resort. This shows the device. On the left, there's a picture of the device. At the bottom of it is a pump, where one pumps fluid from the sphere into those erectile cylinders that are put in the erectile bodies of the penis. And in the cartoon on the right, one sees that the penis goes from flaccid to erect when those cylinders are filled. So, in summary, almost everyone can be successfully treated if they have erectile dysfunction. Vacuum devices and constriction rings are simple and effective. Oral medications work well in most patients, but other options are available but rarely needed. So, the next question, can men with spina bifida become fathers? Well, looking at 3 studies, one from Philadelphia, 2 had tried but failed. Quite different in another part of Pennsylvania where 11 had tried and 8 were successful. And an old study from Wales in the United Kingdom where 16 of 28 men were married or living with a partner and 8 had fathered a total of 23 children. So in summary, 50 to 75% of men with spina bifida can become fathers, but the level of the neurologic lesion is important because it controls ejaculation or delivery of the semen. So, since most patients with spina bifida have abnormal bladder function and possibly abnormal erectile function, this obviously can affect reproduction. The same nerves that control semen emission and ejaculation as control the erection. Thus, many of these patients will have abnormal semen release. So, of course, ejaculation, one is sending the sperm out to do their work to fertilize the egg, shown here. So, how does ejaculation work? Well, this cartoon shows the testicle down at the bottom where the sperm are made, and then they go to the epididymis, which is that snake-like thing that sits on top of the testis. And so in this cartoon, the red line shows the vas deferens that carries the sperm from the testis and epididymis up into the urinary tract. In green, the seminal vesicle creates much of the fluid that is in semen that nourishes the sperm, as does the prostate gland, shown in blue. Above the prostate gland is the bladder, and of course you can see the penis there. So, again, here's the bladder in this cartoon filled with yellow urine, and the sperm is put into the urinary tract below the bladder in the prostate, where the ejaculatory ducts empty. So the bladder neck needs to be closed here so that the sperm does not go up into the bladder, but actually move downward into the urethra in the penis, and then the muscles in the penis, actually above the scrotum, shown there in maroon, will then project or propel the semen out the penis. And of course there needs to be nerves to close the bladder neck and cause stimulation of those muscles to propel the semen and make sure it doesn't go into the bladder, so that it fires forward, so to speak. So what can go wrong? Well, there can be anorgasmic, where you don't have an orgasm, and the consequence is no emission of semen. The treatment for that is vibratory stimulation, as I talked about earlier, or electroejaculation, where an electrical device is placed actually into the rectum where it can touch the prostate and the nerves and stimulate them to cause ejaculation. We don't have much literature on this in men with spina bifida, but there is a large experience in men with spinal cord injury, which is somewhat similar. This looks at an 18-year experience in 500 men with spinal cord injury, and there was a 97% success in sperm retrieval without surgery. 9% were able to do it with masturbation. Penile vibratory stimulation was successful in 60% whose lesion was T10 and higher, If it was lower and the nerves down there were altered, it was only 21%. Lastly, electroejaculation was utilized, and 92% were successful. What else can go wrong? Well, there can be bladder neck dysfunction, and the consequence is that at ejaculation, the semen goes into the bladder. That's really not a bad problem. It doesn't hurt anything, and the treatment for that is actually before sex or before semen retrieval, is to put a special fluid into the bladder by a catheter, then have ejaculation. The semen would go up into the bladder, and then you put a catheter into the bladder and retrieve the semen plus the nourishing fluid, and that can be used to inseminate the partner. What else can go wrong? Well, there can be lack of ejaculation, and so that the semen does go into the urethra, but then it slowly trickles out of the penis. And the treatment there would be that the male would just need to wait longer and leave their penis inside the vagina longer to let the semen slowly trickle out and be contracted up into the female reproductive tract to fertilize the egg. Or the semen can just be collected into a cup and then used for artificial insemination. What else can go wrong? Well, there can be obstruction of the transit of sperm and semen. The causes of that could be bladder neck surgery that extends down into the prostate and could cause blockage of the flow of semen, or chronic infections, particularly epididymoorchitis or epididymitis, which can cause scarring in the fine little tubes that carry the semen from the testis to the outside. Other causes of infertility could be primary testicular failure, where the testicles just don't make sperm, or progressive testicular damage from recurrent epididymoorchitis or chronic obstruction. So, now moving on to, we have concluded that men with spina bifida can have children. Is there an increased risk of spina bifida in their offspring? The answer is yes. About the risk is about 1 in 23, which means that about 4 to 5% of children of parents with spina bifida will have spina bifida. That compares to the incidence of spina bifida in the total U.S. population of 1 in 1,430, so it's an increase of 6,200%. It's higher in male offspring. Sons are it's lower in male offspring, 1 in 50 chance. In daughters, it's 1 in 13 chance. The risk is the same whether the mother or the father has spina bifida, and it's thought that this can be reduced by maternal folic acid supplementation. So whether the woman has spina bifida or her partner has spina bifida, the woman should be taking high doses of folic acid several months before even thinking about getting pregnant, so that she has a good folic acid level in her bloodstream. So our take-home message is that the majority of men with spina bifida can conceive. Some will need help from doctors. And if you are sexually active, be sure that your female partner is taking supplemental folic acid. And also know that contraceptives do not always work if you're not trying to have a child. This graph shows that looking at birth rates among teenagers, and you can see how high it is in the United States at the far right. So a lot of people having unprotected sex, and a lot of people getting pregnant. So the first thing about having unprotected sex, one needs to worry about sexually transmitted diseases, or STDs. Just because one has a problem with erections, sensation, orgasm, or fertility, these do not mean that one cannot contract STDs. The most feared, of course, is HIV, the virus that causes AIDS. There's also an increase these days in syphilis, gonorrhea, herpes, etc. There are only 2 ways to prevent STDs: abstinence, or not having sex, or use of condoms. So let's talk about condoms. If one's talking about sex, one has to talk about protection. Condoms are good protection against STDs, and they're the only proven male-controlled protection against pregnancy. Of course, they're also known as rubbers, And we know that 73% of individuals with spina bifida have a latex sensitivity, so we can't use rubbers. We need to use non-latex condoms. There are a variety of kinds. There's the natural or lambskin. They are pretty good against protecting against pregnancy, but they have no protection against STD. They don't prevent viruses from getting across, or bacteria. The next kind are polyurethane. They don't stretch as well as latex, so they don't work as well as latex condoms. They're more prone to breaking or slipping, and so their protection against STDs is unclear. Finally, there's polyisoprene, which is what the gloves I use in surgery are now made of, and they work just as well as latex condoms, and so those are really the preferred kind. So the natural lambskin, here's your brand called Natural Lamb. They cost about $2.50 a piece. Polyurethane, again, these are not equivalent to latex. These are two brands here, and they're a little less expensive. There is something called a female condom that's worn by the female, and they cost a little bit more. And then the polyisoprene, remember that isoprene, it's equivalent to latex. They're even cheaper. So this is the main brand out there, Skin, S-K-Y-N. And so I would recommend that for men with spina bifida because it works just as well as a latex condom, but it is not made of latex. So right now, that seems to be the best. How did I find out this information? If you forget it, I just Googled non-latex condoms. So, finally, men with spina bifida are not immune to the problems that plague all men as they age, and those are prostate problems and erectile dysfunction. So even men who don't have spina bifida are more likely to have erectile dysfunction as they get older. So let's talk about prostate problems. The most common is benign prostate hypertrophy, meaning benign meaning not cancerous, and hypertrophy meaning enlargement. It's an inevitable part of aging. The prostate will enlarge as you get older. Urination will get more difficult as the prostate growth squeezes off the flow of urine. Remember, the prostate sits right below the bladder. And so some men will require surgery to reduce the size of the prostate. Also, there's prostate cancer. There are two kinds. There's clinically insignificant, where men have it but die of other causes. It really doesn't affect their health at all. And then there's a clinically significant that is potentially lethal. Clinically insignificant prostate cancer is an inevitable part of aging. Up to 90% of 90-year-olds will have some focus or spot of cancer in their prostate. But nearly all will die with prostate cancer, not from prostate cancer. Clinically significant prostate cancer is the most common non-skin cancer in men. It's diagnosed in approximately 1 out of 6 American men, or 17%. And it is age-related. It's extremely uncommon before age 40, only 1 in 10,000. But men 40 to 59, 1 in 38 will have it. In those age 60 to 69, 1 in 15 will develop it. And looking at the 2010 American Cancer Society estimates, there will be 218,000 new cases of prostate cancer in the U.S. and 32,000 men will die of prostate cancer in the U.S. We have no information in men with spina bifida, but it's likely that just like in men without spina bifida, that prostate cancer will develop as they age. How does one detect prostate problems, either enlargement or cancer? Well, typically a rectal exam in this cartoon shows the doctor's finger, the rectum, and you can feel the back of the prostate there. The other way for early diagnosis of prostate cancer is a blood test called prostate-specific antigen, or PSA. However, doctors cannot agree if screening for prostate cancer with rectal exams or PSA actually reduces the risk of death from prostate cancer. So that's a great debate these days, but something to talk about your doctor with is, should you have PSA checked? As a urologist, We tend to think it is important, but there are other doctors who do not. So, in summary, men with spina bifida want to have sexual contact. Men with spina bifida can have enjoyable sex lives. Men with spina bifida can possibly father children. There are medical therapies available if any of these things are problems. And preventative health care is important as one ages because most men will develop some problem with their prostate, whether it's benign or cancerous. Thank you.
Thank you for attending this session. Because meeting your needs is important to us, we need your feedback on this presentation. Please take a few moments to complete our evaluation, which can be located by clicking on the presenter's name located to the left on your screen. It will only take a few clicks of your mouse to provide us information to make the SBU experience better for you and others. If you have any questions relating to SBU, please contact us at sbu@sbaa.org.